Live from downtown Honolulu, it's The Moving Body with your host, Dr. Bernie Portner of Portner Orthopedics, recognized as Hawaii's leading sports medicine and orthopedic specialist. And now, here's your host, Dr. Bernie Portner.
Good morning, Hawaii, and welcome to The Moving Body, just in the nick of time. Like the man says, I'm here to answer your questions for the next hour regarding arm, leg, neck, or back pain. This is The Moving Body. We talk about the body parts that move, the arms, legs, neck, and back. It's a good time to call because soon the lines will be full, and you won't be able to get through it maybe. So if you have a question for me, don't hesitate in life. Take advantage of 521-8383. If you're listening from a neighbor island or indeed from the mainland on iHeartRadio or some other contraption that gets you internet radio, you can call toll-free 1-888-565-8383. That's 1-888-565-8383. So there you have it. We're ready to take your calls. In the meantime, happy Saturday, or like we say in the old country, good Shabbos, August 16th, 2014. I always say the date nowadays. I've been trained well by a certain particular listener to say the date. And then lately I've been getting it wrong. Not completely wrong, but maybe like the wrong month. But it is August, and it is August 16th, and it is 2014, and it is a beautiful, if a little bit gray and wet, Saturday morning. But any morning is beautiful if you wake up on this side of the grass, and certainly we all have. So we'll be thankful for that. Wow, what a week. So this week, after 28 years on Pi'ikoi Street, practicing non-surgical orthopedics, I finally took the dive and moved out. And yesterday, I spent the whole day, except for when I surfed first thing in the morning, but not counting that, I spent the whole day with the rest of my staff, doctors, therapists, everybody. I spent the whole day packing up. And as we speak, or pretty soon, the movers will come and take everything into trucks and drive it down to Bishop Street, 1132 Bishop Street, where my office executive director, Mr. Tony Ichishita, and his trusty sidekick, Haley, have put together a new clinic, a really nice, shiny, sparkly, spacious, pleasant new clinic. And I was there yesterday seeing it really for the first time since it was semi-finished. And it's breathtaking. It makes me look forward to working. So that, there must be something good going on there. And but it's really, really nice, and I'm very grateful to them and for everybody to help me make this move. And to be honest, I was frankly a little bit, or maybe more than a little bit, emotional. Thursday, I saw patients for the last time, again, after 28 plus years, for the last time. I saw patients on Pi'ikoi Street. And Friday I spent packing and tossing, frankly, 28 years or more of accumulated stuff. What struck me is how many articles I had that we used to, in the old days, meaning, like 3 years ago. But in the old days, we used to see an interesting article and copy it, make a hard copy on the copy machine and put it in a file. We had a file labeled low back pain and facet joint pain and herniated disc pain and sciatica pain and all those kind of things. And it would be in files, and years go by, and these files stay closed because, heck, I can look anything up. I could Google anything and get up-to-date information. So there goes 4 decades, basically, of articles or more, maybe closer to 5 decades of articles that I've been accumulating since medical school. And they're going to be electricity pretty soon. I think they're going to be taken by the refuse to Hawaiian Electric and burned and light our lives in another way. So these articles were very enlightening when they were first created, and now they're going to be enlightening as we destroy them, if I can wax metaphorical. Anyway, but we're here live to live now, not 3 or 4 or 5 decades ago. 521-8383. Give me a call if you have any questions regarding arm, leg, neck, or back pain. I'm maybe lost for words here. One of the things I want to express, and then we'll stop being so nostalgic, is I didn't anticipate the degree to which I would be emotional about this very major change in my life. And sure enough, I was. And it surprised me a little bit that I was moved by this whole thing. It's the end of a chapter in my life and the beginning of a new one. And not that long ago, I was very close to retiring altogether, and here I am instead starting a new clinic. So life comes with a lot of curveballs, I suppose. Again, 521-8383. Give me a call if you have any questions regarding arm, leg, neck, or back. One thing I want to say, I see a couple calls are starting to come in. One thing I do want to say is that some of my patients, not all of them, not even most of them, but some of them, are very discouraged about me moving downtown. They never go downtown. They get lost downtown. The traffic is terrible. There's one-way streets. There's parking is an issue. I hate it down there, and I fear that some patients won't come to me anymore because of that. I want to reassure everybody. The clinic is super easy to get to. There's tons of parking, and it's validated, and it's easy. And downtown can be fun, by the way. If you're going to go downtown to see a doctor, you can spend another hour and do some shopping, do some people staring, do some good eating, take in the sights of Chinatown. It's a wonderful, wonderful place. A lot of art galleries. More on that later. But let me talk to this caller here. Alan, go ahead. You're on the air, and thanks for calling.
Yes, good morning. One of your long-time listeners. I figured I'd just call in with this one question. My right hand thumb has, over the years, got a 20-degree bend in it. Doesn't hurt at all. It's quite functional. But where the left-hand thumb is perfectly straight, as it always was, the right-hand thumb has got this 20-degree bend at the joint outward.
Outward away from the palm.
Right.
Lateral. And you say it doesn't hurt at all. Does it work normally?
Yeah, it works fine.
Is it your right hand or left hand?
Right hand, and I'm right-handed.
Yeah. And you can shoot your revolver, no problem.
Well, actually, I used to have a revolver, but yeah, my trigger finger is fine.
And what's the beef? You say it doesn't hurt and it works. Is it the aesthetics of it that it just looks weird?
Yeah, just curiosity.
Is it progressing? Is it getting the angle getting steeper?
No, it's been this way for a number of years now.
Mm-hmm. And you're not a hand model or anything like that, are you?
No.
There are those, there are people that model hands, and they...
Okay.
Yeah.
No, I'm just curious if there's anything I should worry about.
No, I think you should worry about other things, but not this.
Okay.
And as far as watching out, I mean, be aware if it progresses, if the angle seems to get steeper, or if it starts to hurt, or if it gets more and more difficult to use. And if any of those things occur, then seek attention. But if you just got a crooked thumb, and everything else is wonderful under the sun, you just be happy, I think.
Okay, just thought I'd bounce it off you.
All right, I appreciate the call, Alan.
Righto.
Yeah,
Bye-bye.
thanks for listening. Bye-bye. Let's see. I'll take my next caller. They're just flying in here. Mita, go ahead. You're on the air, and thanks for calling. Oh, and turn off your radio.
Hello?
Yeah.
Oh, yeah.
Mita.
Hello, doctor.
Yeah.
Yesterday I had a back pain, upper back pain from washing dishes in the sink in the bathroom because kitchen was having a plumbing problem. So I had to wash dishes in the bathroom, and I felt pain in my upper back.
In the upper back, huh? You mean by your shoulder blades or right below your neck? Where exactly?
Like the shoulder blades area.
On both sides or in the middle?
Right in the middle, yes.
And does it hurt you now?
No, I just woke up, so it doesn't hurt me now.
Oh, good. And if you move your head around and bend your chin to your chest and look up at the ceiling, does that bother you at all?
No.
And if you twist your body, like you want to twist around to look behind you, twist your whole torso, your whole trunk, twist it to the right and twist it to the left, does that hurt at all?
No.
And then you take a really deep breath, does that bother you?
No.
So nothing hurts as far as you can tell.
Yes.
So it seems to whatever it was, it went away just as mysterious. Oh, it wasn't mysterious how it came. You had to do dishes in the bathroom sink, it sounds like.
Yeah.
I see. So I don't know. What I can tell you is this. It's probably gone forever. Is the plumbing problem fixed? Can you use your kitchen again?
No, not yet.
Ay. Who else can do the dishes besides you at home?
My son.
Yeah, there you go. So until the plumbing is fixed, make sure your son does all the dishes. All right, because if you do the dishes again in the same posture, in the same position, whatever this was is likely to return. And then you'll have it again. And I don't know what it was, but whatever it was relatively minor enough to disappear with a good night's sleep. See, be careful today. Or be careful this weekend, because maybe you're not quite out of the woods. It's a very common complaint. When people have pain in the shoulder blade area, 9 times out of 10, I just made that up, but most of the time, it's coming from the neck. And then the other 10 or 20% of the time, it's coming from the mid-back, as you would expect. And then rarely, it comes from something else. I've even seen patients with internal medicine problems presenting with shoulder blade area pain. But in your case, it was, whatever it was, it appeared to be minor and self-limiting. So don't worry about it, but take care this weekend and pay attention to see if the symptoms return. And if they do, then do something about it. See me or see somebody. Yeah. Okay, Mita?
Yes, thank you.
Any other questions?
No.
Okay, so grateful that you called. Take care. Bye-bye. And she was calling her son as I hung up, say, you got to wash the dishes. Let's see. I have another caller. Jeez, I'm so grateful. Carol, go ahead. You're on the air, and thanks for calling.
Hello?
Yes, you're on the air. Good morning.
Oh, I called the other day to make an appointment with you, but however, I got you this.
I'm not hearing you again. I'm having trouble. Do you have your radio on nearby? Hello? Carol, are you there? I think we lost Carol somehow. Carol, call back if you can, because I wanted to sort this out. Right. So, in our move, we've had to disconnect the phones briefly. We had them going to forwarded to a cell phone, which worked most of the time. So if anyone else like Carol called and couldn't get through, try again. I apologize. We did have our share of phone problems about a month ago, some of you may remember, but those were resolved, and everything seems to be working until, of course, we unplugged the phones. because we're moving. So I apologize for that. Over the weekend, by the way, similarly, the phones, you'll get a voice message to leave a message, and we'll call you back. Maybe not Monday, but maybe Monday afternoon or Tuesday morning. Depends when the company gets those phones working again. Otherwise, we just got to take messages on our cell phone. But we'll try our best. Oh, here's Carol again. Let me try again. Carol, we're having trouble with the phones again, huh?
Yeah, you seem to, even down at Picoya, I couldn't get in for over a month, so I finally gave up.
Oh, what do you mean you couldn't get in for a month?
I don't know. It's something wrong. Always either cut off or...
Yeah. Well,
you know.
I'm sorry about that. A month ago, we did have phone problems, which got fixed. Our phones are dependent on the computers. It's not the old-fashioned landlines, but in order for the phones to work, the computers got to work, and we're having trouble, so I apologize. But except for this weekend, because we're moving, so all the phones are in boxes.
So you all right now?
We're in the middle of moving. So yesterday we packed our stuff, including our phones and computers. This morning the moving company is coming and moving it all. And then all weekend and Monday too, we're hooking everything up. So I really am sorry that you had trouble seeing me. I know it's serious because it's a doctor's office, and if people have pain,
yeah,
it's not like you can't get through to your accountant. That can wait.
It's funny the way this was going on.
I know it's very embarrassing, but I believe that's behind me. As soon as my new office and my new phones are hooked up,
so it's a big move.
Yeah, big time
on
move.
The big boy office.
Yeah. I'm out of that. I'm almost completely out of that office. We saw our last patients last Thursday, 2 days ago. And yesterday we all packed all our stuff, and today the movers are coming. And over the weekend and Monday and Tuesday we're getting set up again. So with any luck, my phones will be back in business on Monday. It's very difficult to try to run an office, especially a doctor's office, without functioning phones. I don't know what to tell you. So, Carol, don't give up. Try again. Leave a message if you don't get through and there's a voicemail that says please leave a message. Leave one and we'll call you. Okay.
I finally got through to her yesterday.
Okay, finally.
I set up an appointment.
Okay, good. So I'll see you at the new office, I guess.
I guess so, but the thing is, I have to go on a cab, and it's because I'm still using my walker.
Yeah, it'll be easy for you. There's all kinds of easy, what we call ADA access. So there's ramps and elevators, no problem. Okay, Carol?
Yeah.
All right, I'll see you soon. Yeah. Thanks for persisting and not giving up.
Bye-bye. Thank you.
Okay. Take care. Let's see. I know. I apologize to Carol and everyone else. Our phone company and our computer company, which there's overlap, had serious problems to the point where I started to talk to Hawaiian Tel, the old-fashioned landlines, which are very expensive, but at least reliable. And we haven't quite made that step back to the past. But hopefully the phones will be working fine and we shouldn't have that problem anymore. Let's see. There's Claire. Claire, go ahead. You're on the air, and thanks for calling.
Hi. Thank you for taking my call. I have the back of my neck. It's like I have a lot of stress back there.
Yes.
And, every once in a while I'll just massage it myself by just reaching back there and just squeezing the heck out of it.
Right.
And it seems to help a little bit. I was wondering, what should I do about that one? I thought, well, maybe I need a massage, go find a massage or something.
Well, Carol, it's Claire. I'm sorry. Claire,
no problem.
I'm glad you asked that question. Not so much because I can help you over the phone. I probably can't. But I'm glad you asked the question the way you framed it. I'm wondering, I have this symptom, you say, it's neck pain, but you could say back pain or shoulder pain or knee pain or hip pain or ankle pain or wrist pain, I don't care. But you say, I have this symptom, my neck is killing me.
Mm-hmm.
What should I do? Should I try massage? Should I try chiropractor? And I love that question because it's the wrong question. I want you and everybody listening to pay attention here. Don't ask the doctor or anyone else, what can I do for my blank? By blank, I mean in your case, neck pain or my headache or my shoulder pain. We don't ask, what can I do for this pain? We ask, what's causing this pain? Because until you know what's causing it, we won't know what to do. Otherwise, you're stuck. You know, you're like at a restaurant, and you open up a menu, and on the menu it says back pain, and then under back pain it says massage, $75, chiropractor, $100, physical therapy, $200, Chinese herbal medicine, $45. You know, it's a menu, and you pick and choose. What can I do? I got this neck pain. Let's see. I could try this. I could try that. I could try this. I could try that. Well, you could. You go ahead and try this and that. It's usually safe. And then if you come up with something that works, or if your neck pain goes away by itself, fine, you're home free. But then when it doesn't go away by itself, and none of these items on the menu work, then you come see me. Because then I'm going to try at least, and usually successfully, I'm going to sort it out. I'm going to figure it out. You have neck pain because you have a disc. I'm just making that up. I don't know if you have a disc there, but let's say you have a disc. Okay, for a disc, I know I can give you traction. I can try mobilization, or I can look at your neck and examine you and say, oh, you have neck pain. Of course, you have an arthritic facet joint. And for this, I can give you a certain type of pill. I can give you a certain type of exercise. And if that doesn't work, there's a certain injection that will work. Or I can examine you and find out that you have a torn muscle causing your neck pain, in which case the treatment is altogether different. So you see what I mean? You don't want to treat a symptom with a certain guess. Let's try this, let's try that. If you have a symptom and it persists, like neck pain, you want to make sure that you know what you're dealing with. Sometimes neck pain can be caused by a very serious disease. And you want to find out about that, I suppose, although that's rare. And other times, it's something that's readily identifiable, and then we can go ahead and treat it directly without guessing so much. Okay, so I told you everything but what you wanted to hear.
Exactly.
I know. Which is a question I have trouble answering. Yes, you can try massage, and yes, you can try acupuncture, and yes, you can...
A process of elimination?
Yeah, you can try that, but there's a better way.
Okay.
Well,
I'm glad to hear that.
Yeah, there's a better way. So it's a weekend, and you can try this and that, and you know sometimes home remedies work. A nice a heating pad can help. Sometimes people like ice instead. If massage works, go buy yourself a massage. Worst comes to worst, you'll be in bliss for an hour or two. And then it'll come back. But
yes.
Monday or Tuesday, or even now if you want to call and leave a message, if you decide to get this taken care of, give me a call. How long have you had this neck problem?
A long time. Very long time. Very long time.
Yeah, so I think you need to come in and let me have a look at you.
Will you be having the same phone number, by the way?
Yeah, the same phone number. The only difference is now it's going to work.
Okay.
All right.
I enjoy your show. Thank you so much.
Thank you for calling, Claire.
Bye-bye.
Bye-bye. So, wow, we had a nice beginning to the show. The lines are again open after the first flurry, 521-8383. Give me a call if you have any questions for me regarding arm, leg, neck, or back. And in the meantime, I have free time, free play to talk about whatever we want. And I want to talk about certain patient, but actually I want to talk about a certain doctor. We had a patient come in with a long history of shoulder pain. I don't remember, but it was several months at least. And the patient had already been to several different places to get help, and didn't really get satisfaction. And he had shoulder pain, couldn't use his shoulder, couldn't sleep, had trouble doing even simple tasks. And he came to my office, and I have a new doctor, Dr. David Bro, who listens to the show. So, Dave, hello. Good morning. And his family that just arrived from Tennessee is also here. Jordan, his son, who's going to start high school, I believe. And Chrissy, his wife, who just came and moved, lock, stock, and barrel, moved over here. Anyway, Dave came, Dr. Bro came to study under me for a year, and then to join me as an associate and work with me forever, maybe, hopefully. But this story is about this patient who came after suffering with shoulder pain for many months. If Dave's available and he wants to call, he can give me the real lowdown. And I was starting to teach Dave on how to examine a shoulder. Now, Dave's been around the corner. He's not a youngster fresh out of school. He has been around, and he went through his residency, and afterwards he did a residency in physical medicine rehabilitation, just like me. And afterwards he worked, I think, in an orthopedic clinic. And but I taught him how to examine a shoulder precisely, with specificity, with the ability to distinguish between one tendon and an adjacent tendon to decide which one, if either, is involved. And Dave got to see this patient on his own. Usually we see patients together, but slowly, he's seeing patients on his own. He sees this patient. He applies this new knowledge that he has after studying with me on how to properly examine a shoulder. He comes up with a precise diagnosis. He decides to give the patient a shot. He gives the patient a shot in a very precise location, in a very precise technique, one that he didn't know a few weeks ago. And he comes, and the patient has the shot, comes back a week or two later, and he's all better. And Dave comes running into the office, which we share. We share an office. At least we used to. In the new office, I'll have my own office. But that's another story. And he was so stoked. He was so happy that he was able to help the guy. You know, a lot of, in modern times, there's a lot of stuff about doctors and insurance and Obamacare and cost and all that. But what keeps us the doctors going, and this has been true for the millennium, is the joy we feel, the satisfaction we feel when we actually are successful at helping somebody. And that's the feeling that Dave had, Dr. Bro had, when he came in with this shoulder pain patient, who he knows he wasn't going to help, as the guy saw him a month ago. In fact, the guy said, "Why didn't I come and see you 4 months ago?" And the answer was that 4 months ago, Dr. Bro didn't know how to do what he just did. So it's very gratifying to him. It was very gratifying to me as his mentor that I'm passing on this knowledge of how to examine not just the shoulder, but all the joints. And like they say, it's not rocket surgery. You can learn this. And he is, and he has been, and he will continue to. And it's a story of a simple shoulder problem that was misdiagnosed and mistreated and suffered unnecessarily for many months. If only doctors knew what Dr. Bro is learning on how to properly differentiate what the heck is causing it and treat it precisely. So it was gratifying to me as the teacher. It was gratifying to Dave, Dr. Bro, as the treating physician. And most of all, I guess, it was gratifying to the patient, who now can live back a normal life and not take pain pills and build up his shoulder strength and hopefully not have a recurrence. So that's the story of the supraspinatus tendinitis treated, I guess, for the first time by Dr. Bro. First time effectively and accurately. 521-8383. We're talking about a lot of things, but we could be talking about back pain, if you have any and you want to talk about it, or sciatica, which means pain down the back of the thigh, or knee arthritis, or hip arthritis, or elbow pain, or tennis elbow, or carpal tunnel syndrome. I had a patient with what's called tarsal tunnel syndrome, which is similar to the carpal tunnel syndrome, but it's in the ankle instead, and your foot gets numb and your toes instead of your fingers. But otherwise, it's very, very similar and can be treated pretty effectively as well. The number here, 521-8383. If you're listening from a neighbor island or from the mainland, you can call toll-free 1-888-565-8383. So I spoke a little bit about my new clinic that's getting set up and will be fully in business on Wednesday, unpacking and setting up Monday, Tuesday. But I wanted to talk to people about this art program that we set up. In order to put art on the walls, so it wouldn't be bare walls, I decided to come up with an out-of-the-box idea to have real art, not poster art, not pretend art, not, palm tree, tourist, diamond head motion art, but real art made by real artists, one-of-a-kind artists. And I pulled it off. I'll tell you about it all in just a minute, but I see that there's a caller, Leela. Leela, go ahead. You're on the air, and thanks for calling.
Good morning. I'm calling because my right foot, I have a lot of pain, especially in the morning, and when I'm walking, it's more on the arch of the foot and going towards the toes. Nothing on the heel. There's no pain there.
Uh-huh. And you feel it first thing in the morning especially?
Yes.
And then during the day, after you walk a few steps or a little bit, does it feel a little better after you get up on it and move around?
Yes, it does, but it's still tender all throughout the day.
And then at the end of the day, if you have a lot of time on your feet throughout the day, at the end of the day, is it again pretty bad?
No, I'm not on my feet a lot during the day.
I see. And how long has this been going on?
Probably about a month now.
About a month. And do you have any clue as to why it came on? A month ago, did you do anything out of the extraordinary routine? Did you do a lot of walking or a lot of traveling or?
No, I didn't. And there's no swelling on the foot, or that I noticed.
Yeah. And it's not on the top of the foot. It's on the bottom by the arch going towards the ball and the toes of the foot.
But actually, I can feel it on the top. But I think the pain is when I put the pressure on when I'm walking.
I see. And no trauma. You don't remember dropping anything on it or twisting it or anything like that?
No.
And it came on gradually? You kind of noticed a hint of it, and as the days went by, it started to worsen? Or did it come on all in one time?
No, it gradually started to worsen.
Uh-huh. It gradually came on. So, and this has been how long? 1 month?
About a month, yeah. Might have been longer. Time flies.
Mm-hmm. So, over the phone, it's not easy, but this is not what we call plantar fasciitis, probably. Plantar fasciitis, like your pain in the foot, hurts first thing in the morning the worst. And so that's true of your condition as well. But otherwise, the similarity ends because the plantar fasciitis is typically heel pain. Your pain is further towards the toes and also involves the top of the foot.
Yes.
And so it's not that. I've seen, the possibilities are these. Leela, I'm going to use your question not so much to tell you what you got, but to tell you and the listeners how this type of problem is approached. Pain in the foot, first of all, can be in one of two categories. The most obvious category is you have a problem in the area where your foot hurts. And and you would say, oh, duh, of course. But that's not necessarily a duh. But, maybe you have a joint in your midfoot that is inflamed. Maybe you have a ligament in your midfoot or a tendon in your midfoot that's inflamed. Maybe the bone itself is somehow has what we call a lesion, which means any sort of abnormality like edema, swelling, there's a lot of different possibilities. But the first category of what could be causing your foot pain are what we call localized problems. The other category is referred pain, and that is when you have a problem somewhere else, let's say in the calf or the knee or all the way up in the back, that's manifesting as a referred phenomenon, presenting as pain in the foot. That's not likely in your case the way you describe it. Right now you have foot pain. If you grab your foot where it hurts and squeeze, is it extra sensitive?
Yes.
You see, you can do a physical exam over the radio. So, I can't say what it is, but what I can say is this. Listen carefully. Whatever it is, it's very likely easily diagnosable. You know what I mean by that? Find outable. We can usually figure out what it is exactly. And then once we know what it is, it's treatable. So don't live with this. And don't go and try to, let me try a cushion here, or let me put an insert in there, or go see a chiropractor for this. Don't do those things. Have it looked at either by me or some other specialist that knows their way around the foot and maybe isn't interested in doing surgery. You got to avoid that. And have it fixed. See me in my new office. How would that be? You could be one of my first new patients.
I would love it.
Yeah. So I would love that too, because for some reason I really enjoy taking care of the foot. People don't realize it, but when your foot hurts, your life goes down the tubes. You can't enjoy your life in your case it's not so bad, because once you get up and move around, you don't hurt so much and you don't spend a lot of time on your feet. But imagine if you were a mailman, or imagine if you stood all day, or it was a waiter or something like that. It would destroy you. Plus, it would destroy your routine. You would have to alter your life. Foot pain is terrible, and it really has a great negative influence on the quality of your life. When you have a bum foot, things are not going well. So have this taken care of before it gets worse. And I can't make any promises, but usually it's easy to take care of.
Okay, wonderful.
All right. Hope to see you over at on Bishop Street.
Okay, thank you.
All right. Take care. Thanks for calling.
Bye-bye.
Bye-bye. Let's see. I have Rory, it says, but I bet you it's Roy. Roy, go ahead. You're on the air, and thanks for calling.
Hey, Dr. Porter.
Yeah. How's it going?
I just want to get the other day I went for a hip x-ray now. My doctor, I complained to him, still my pain doesn't go away, yeah?
Yeah.
So I told him when I walk, as I walk about 5 minutes, the pain gets go like by the hip area and down to the calf.
And how did the x-ray look?
Oh, I didn't get the results yet. I mean, I got to go back next week to get
I see.
But I was going to ask you, my therapist says, is that hip symptom can be what? What is the symptoms of a hip problem?
I can tell you that. Pain in the hip is usually caused by one of three areas. Either a hip problem, just like the foot. It's either comes from the foot or from someplace else. A hip problem, a problem in or near the hip. Most commonly, hip arthritis in a man your age. So hip arthritis can cause this. Sacroiliac joint problem, a strain, that's a joint in your back, in the pelvis behind your hip. That can refer into the hip. And of course, that old friend of ours, lumbar spinal stenosis, can cause hip pain with walking or standing. And to figure that out, x-rays can help, but it's mostly the physical exam. Twist the hip, see if it works. Stress the SI joint, see if that hurts. Examine the lumbar spine, See if that bothers you. Take a good history. For example, does your hip hurt only when you're walking, or does it also hurt if you're sitting? And
sitting too.
Yeah.
You know, when I put weight, like if I position when I sit,
yeah.
I gotta lean to the right, like
because otherwise
ease off.
Your left hip hurts.
Yeah.
So that's very typical, by the way, of a sacroiliac joint problem. So believe it or not, that kind of history can be very, very useful in terms of helping us diagnose things. So see what the hip X-ray shows, and if it shows a little bit of arthritis, maybe that's what's causing your pain. Can you sit cross-legged on the floor?
Okay, this is what happened. You know what I do with my peripheral stretch?
Yes.
You know, when I pull, okay, you pull, like you cross I put my left leg over my right leg, right?
Yeah.
When I try to pull, that's why I told my therapist, I say, I feel pain right where the hip.
Yeah, that's not a specific enough test, but answer my question. Can you sit cross-legged like an Indian?
Oh, you mean sit on the chair?
Sit on a floor cross-legged, like in the lotus position, like in India when you do yoga. Can you sit in the lotus position? Cross your legs in front of you. Like
you mean cross? Oh, yeah, I can do that now.
Does it hurt?
No, but you know when it hurts? When I get up.
Yeah.
Like I sit on a chair. Okay, like when I'm in the toilet, I try to stand. Oh, then it pinches right by the hip area.
Yeah. Well, it's frustrating over the phone because I can figure this out in person, but over the phone, it's a little bit more challenging.
Okay.
But
if he says, let's say if it's Sahib, he told me it might be arthritis.
It might be.
What will be the next step? Surgery?
No. Roy, you've been listening to my show for how many years?
No, my therapist say.
No.
Then I got to consult with a surgeon, orthopedic surgeon.
There's good physical therapy. There's good medications. There's good injections.
That's what I was telling him.
You don't want to have your hip replaced until you can't walk.
Okay, that's the least you would think of surgery, right?
Well, I think that hip replacement surgery, and this is coming from a non-surgeon, and this is coming from an orthopedic physician that tries to avoid surgery as much as possible with my patients. Hip replacement surgery, in my opinion, is perhaps the single greatest operation known to mankind. People have years of hip pain to the point that they can no longer even walk to the bathroom without a great deal of effort, and they go have their hip replaced by these magicians, these orthopedic surgeons, who, no matter what you think, are just gifts to us, because without them we would suffer so much. Orthopedic surgeons, people might be surprised to hear me say this, but orthopedic surgeons are so valuable to us. But let's put that aside. People have years of hip pain from severe now bone-on-bone arthritis. They can no longer even get to the bathroom, just the 10 steps to get to the bathroom without a great deal of effort and limping, and have a surgery, and that night they're walking almost without pain. They can't believe it. So it's a very miraculous appearing surgery. When people need it, you can't beat it. In your case, you're a long way from that. You can walk to the bathroom.
Oh, yeah, I can walk. I can go shopping. Okay, this is another problem. When I standing up, I cooking, that's when I feel, it gets tired and sore. Like when you put weight, I got to sit down and rest. Is that the symptoms of my hip?
That's more the symptoms of a spinal stenosis. But rather than guessing, you have to find somebody who knows how to examine the hip, SI joint, and lumbar spine. It's not that difficult. And then an
orthopedic surgeon can do that?
I would hope so. I can only say that.
Because my GP said that he was going to refer me to a physiatrist. That's what I was trying to tell him, but they booked for till September.
Yeah, and physiatrist doesn't guarantee they know how to examine this. There's no guarantee there. And an orthopedic surgeon probably can, but there's no guarantee there either. That's the thing. That's what I'm trying to tell you. There's not that many good physical exam diagnosticians anymore. They're dying out. And
yeah.
people are just looking at X-rays and MRIs and not talking and spending time and listening to the patient and examining the patient carefully, and they should be.
Okay, what about like a physical therapy? I've been going to him for almost 9 sessions.
Well, I think that speaks for itself. He doesn't know the diagnosis either?
Well, no, he suspects now. That's why he told me, you got to go back to your GP. He thinks, I could be getting hip arthritis.
Well,
something.
good.
I mean, huh?
You go do that, man. Every time I get a call from you or somebody else on Kauai and I get these frustrations, I want to get on a plane and go over there every once in a while.
You know, that's why I was going to ask you. You know what, I talked to the therapist yesterday.
Yeah.
Okay, he stopped me from coming back because he said you can only get 18 sessions during a year, right?
That I don't know.
Therapy.
It depends on the insurance plan.
Yeah, for Medicare anyway. Okay, then you know what I told him? I just said I listened to you, Dr. Porter, and you know what he said? You got to be careful about what you listen on the radio. I don't know if he's trying to brainwash me or try to doubt what.
Well, I agree with that you have to be very careful what you hear on the radio. And you should doubt everything. A lot of charlatans are on the radio and they got something to sell. I got nothing to sell. What I'm doing here is I'm trying to educate, and you should be careful. I'm not brainwashing anybody. I'm telling you to go ahead and follow your doctor's suggestions. But I question,
that's why I keep questioning him. When I go to the therapist, I just thought, I do the exercise, I keep telling him. Yeah. I keep doing this over a month and a half. I get a little better, but I might be good today. Next day, I'm back to where I'm at again.
Not good enough. Okay, Roy, let me know how this goes, and who knows, maybe one of these days you'll get on a plane and come see me.
I might think about it already. If it comes to life or death. See.
Yeah, well,
every time it's affecting my life.
Yeah. Well, perhaps keep me abreast of what goes on there. Okay. Thanks for calling,
thanks for the info. Yeah.
You bet. Take care. 521-8383. We have time for another call or two. Let's see. Sally, go ahead. You're on the air, and thanks for calling.
Hey, thanks for being there. I heard the supraspinatus tendinitis. Yeah, I don't know if it's my delt or my supraspinatus. How can you tell the difference?
Because it's almost never the delta. Almost
really?
never. The deltoid muscle is really strong and big, and the same motion, which is called abduction, that's the main motion of the deltoid, although it does also bring the shoulder forward and backwards. Its main motion is to move the arm out to the side. That same motion is also the motion of the supraspinatus tendon, which is a smaller tendon and not attached as strongly. So when something breaks down, it's almost always the supraspinatus rather than the deltoid. So just as a matter of statistics, you can if those are the two choices. I'm not saying those are the two choices, but given those two choices, I would say that it's the supraspinatus over the deltoid because deltoid tendinitis is very unusual.
So you can have it like 10 months?
Yeah. You can have it as long as you want.
What about the treatment? Is that the one where you shoot the plasma in there?
It can be. That's not the first treatment. If we're assuming that we're talking about a supraspinatus tendinitis, what Dr. Bro injected was a tiny droplet of cortisone mixed with some local anesthetic. And he peppered it with 20 little droplets all in and out of the tendon. And that's what took care of it. But yes, we do have PRP that sometimes is used for this. And an injection is not the first line of treatment. First line is you first make the diagnosis, and then friction massage is often all it takes. So you don't have to always inject these tendons. We try not to.
I see.
Yeah.
And then, so when are you going to pack up your stem and your plasma and hit it to the outer islands?
I don't know. I was talking to a friend of mine, Jim Levitt, on the phone, who's on his way to Italy. Jim have a good trip, or like we say in the old country, buon viaggio. But in any case, he was telling me, yeah, you know, you could open up a clinic here and you can open up a clinic there, and by the time you're 80, you'll be a millionaire.
Hey,
I'm a
you
little
can
bit.
You can send your clones out with their stems and you'd be good.
Yeah, my clones. I don't know if I'd call them clones. These guys end up smarter than I am. But yeah, that would be a good idea. I gotta think about that because that's a huge project. And,
well, those guys they wanna live on the outer islands anyway, so they can get trained by you and then
move out there. Yeah, that would be a good idea.
Thank you so much.
All right, thanks for calling. Have a good weekend.
Thank you. You too.
Bye bye. Let's see. I'll take my next caller, which is David. David, go ahead. You're on the air, and thanks for calling.
Yeah. How you doing?
I can't complain. I'm doing pretty good.
Good. I have a question about, I don't know if it's bursitis or sciatis or whatever.
Sciatica. Where's your pain? Let's start with that.
Yeah, right in my right hip in the butt.
In the back, yeah? Does it spread down the back of the thigh?
No, it's right on the butt where I'm sitting.
Only when you're sitting?
Well, it's a constant ache now.
It's even there when you're standing?
Yeah.
And when you're lying down?
No, it was before, but it stopped. It's not when I'm lying down now, but it aches a little bit for a while when I'm lying down, then after a while it'll go away.
Uh-huh. And how old are you?
61.
A young man yet. And what kind of work you do?
Mostly all day I sit at a computer.
I see. And because this hurts, now you have a pain in your butt all day while you sit there.
Yeah, it's a pain in the butt.
It's a pain in the butt.
Yeah.
And do you get up throughout the day frequently?
Yes, I do. Quite frequently. I go to service customers and I do some walking
Dave, how long have you had this?
Well, I had this before when I was sitting on my wallet for a while, and then all of a sudden I started getting a pain and took my wallet out and it stopped. But I haven't been sitting on my wallet. And that happened about 2 years ago. But since my office chair started getting a little hard and the pain came back, so I'm starting using pillows now. But it doesn't seem to be helping. And I went online and tried to research and figure out how to do some exercises and stuff.
Dave, let me interrupt because I only have about 10 seconds here.
Okay.
I don't know over the phone what you have, but get it looked at. Either come see me or go see your doctor. This could be a disc problem. It could be a sacroiliac joint problem. It could possibly be a hip problem, but it doesn't sound like it. But whatever it is, take care of it. I got to go. Bye, everybody. Thank you for listening to The Moving Body. Hope you enjoyed the show. Remember, if you're having problems with your arms, leg, neck, or back and would like to get an appointment over at the office on Pecoy Street, you can give us a call, 596-7300. We're open 6 days a week and have a full line of doctors, therapists, EMG, and a great office staff to assist you. We try to respect your time like we hope you respect ours, so people are seen on time. You don't have to expect to spend the whole morning if you have a 9 o'clock appointment. We'll try to see you right then and there. Remember the warning signals that I talk about throughout the show off and on. If someone tells you that it's only your age to live with it, that the x-ray is normal, nothing's wrong, that it's, quote, arthritis or bursitis or tendonitis, but they haven't really examined you very carefully, be cautious about that. Ask for another opinion. If you're told to have surgery, ask for another opinion. If you're told nothing else can be done about it, you want to say, well, maybe you can refer me to another specialist. Maybe they have a better idea. Don't just accept those kind of things. Don't forget to tune in next week, same time, on KHVH. Go out there and exercise this weekend. It's the single most important thing you can do for your health and body. Health cannot be bought off the shelf. Special nutritional supplements is not what it's going to take to improve your health. It's going to take a lifestyle change. It's going to take for you to put on some good walking